Carl Harrington is going to tell us about what's happening with the new Global Patient Initiative program that he is leading. Carl is also going to referee our great debate. And after the dust settles from the great debate, Dr. Ansel, we hope, will announce the 2023 Research Grant Awards. So now it is my special privilege to introduce Carl Harrington.
Thank you, everybody. They've made a grave mistake today. They're ahead of schedule. And you all know that I can fill time. So get ready for this. But mostly, the most important thing I want to do right now is you heard Lori Rude-Betts talk about the continuity and how there was 21 people that Arnie Smokler wrote to. And one of those 21 people was Judith May. And Judith just arrived. And I'd like Judith to stand. She was the third president. Judith, if you could stand. She's back there someplace. Actually, I've got a better idea. Why don't you stand and applaud her? Come on. That's an amazing continuity we've had in our organization. Yesterday Newton talked about, about a third of the people here being at their first Ed Forum, both here and the ones that are on whatever it's called, on the internet. They're hard concepts for me. And for those people, did you get enough acronyms yesterday? I mean, IVG, CXCR4, BDR. Okay, there were more. IgM, MGUS, MYD8, VGPR, BTK, ASH, EHA, even WM and IWMF. But lucky you thought, okay, it's day 2, I got all those acronyms out of the way. I'm here to give you a new one. And that new one is this Global Patient Initiative. And guess what? It has an acronym. GPI. Because actually, when I started this speech, I thought, well, I don't have that much time. I can't say Global Patient Initiative each time. That'll take too long. Well, I got plenty of time now. Let's see if I can make the next slide appear. Oh, my God, it worked. Okay, so what is GPI? Well, it's a major initiative intended to revolutionize WM education and support, like the IWMF Strategic Research Roadmap revolutionized our WM research efforts. Now, I could spend 20 minutes telling you about that, but I'm going to bless you without that. We started the GPI in 2022. We're going to do it sooner. This little thing called COVID kind of got in our way, and now we're going to expand it nationally, internationally. Globally, is it? Okay, names matter. My name is Carl Thomas Harrington. Our organization's name, we both have first names. My first name's Carl. The organization's first name is International. So what have we been doing? We've done a decent job trying to be international. We have affiliates in 22 countries, every continent except for Antarctica, because apparently penguins and polar bears do not get our disease. But since I'm now filling in time, I do want you to tell you that dogs and cows have been diagnosed with WM. But don't worry, if you have a pet cow, the cow's not going to give you WM, and you didn't give the cow WM. In fact, that cow is dead, I'm sorry to say. And also, dogs have been treated for WM, and no, you can't get it from your dog, and no, your dog didn't give it to you. Anyway, so we're in every continent except for Antarctica, because penguins definitely don't get it. And we translate, so overall we have 22 affiliates around the globe, 22. And Judith can imagine that back when we were starting and we had 21 people. Now we have 21,000 people around the world, and we have 22 affiliates. And we translate almost all of our materials into 7 to 10 languages, besides English, really American. We do Spanish, we do French, we do German, we do Italian, we do traditional Chinese, we do simplified Chinese, and we often do Portuguese, Norse, Polish, and Finnish. And in our database, we have WMers from over 80 countries around the world. So that's pretty good for international, but it's not good enough. We intend to do better. Now here are the vision and mission statements. Can you all see that in the back? Don't all speak at once. Okay. So the important word here is the world without WM. We don't want to have North America without WM. We don't want to have the US without WM. We want to have the world without WM. Now, if you're on Jupiter, you're on your own. We're not worrying about that. We're talking about this world. And the mission statement says, support and educate everyone affected by WM. It doesn't say support people in North America. It doesn't say support people. We don't really care if you're a patient in London, England, if you're a patient in New London, Connecticut, or you're a patient in London, Ontario. And we don't care if you're a caregiver in Indiana or a caregiver in India. Our mission, our vision is on the world, and our mission is on everyone. And while we've done a decent job with international so far, we haven't done good enough. So now I'm going to give you some more eye tests. Now, can you see those back there? Well, I'm going to read them to you anyway. These are global imperatives. They're part of a strategic plan. Yeah, we have a strategic plan, and it's a good one. So this is global imperative number 2, and later on I'll tell you what 1 and 5 are. 1 is the awareness. This is about patient education and support. Awareness, we want to ensure everyone affected by WM knows about the IWMF and the resources we offer. We don't want anybody to get bad or outdated information. It's scary enough when you're diagnosed with WM and you can't pronounce it, your doctor doesn't know it. We want to make sure you have the right information. Everybody, every time, everywhere in the world has the right information right away. And education and support. We want to be the authoritative support source for patient and caregiver education and support. We're an organization of patients. All of us have been through this. We understand this disease from the ground up. We've lived it. Most of our peer organizations are run by professional people, and they don't have the same knowledge and deep personal understanding about this. We want to make sure we are the authoritative source of information. Global imperative number 3 is healthcare professional awareness. We want to reach more patients sooner by ensuring every healthcare professional working in blood cancer is aware of the IWMF and our resources. Now think about it just for a second. Who was the first person that knew you had WM? It wasn't you, it was your doctor. And if that doctor had told you about WM and IWMF right away, we would all be better off. What we want to do is, our promise to the doctors, look, you tell people about the IWMF, we'll educate them, we'll support them, you treat them. We may make them a little too knowledgeable, they may be a pain in the butt, but that's our deal. But we want to reach doctors and nurses first and foremost sooner, so that they'll tell everybody with WM about the resources that we have and we offer. The 4th global imperative is partnership. We're a teeny little organization. We want to actively pursue and develop relationships with like-minded organizations to accomplish our mission. And in case anybody here is really wondering what number 1 and number 5 are, number 1 is about the strategic research roadmap and making sure that we lead the world to do more strategic, better, important, globally supported research. And I think Newton talked about this the other day, about the sun never sets on WM research. We have the best minds in the world working on your disease. That's pretty reassuring. Oh, and the 5th one is about fundraising, diversifying and expanding our fundraising resources so we can do all this other stuff. Now, fortunately, we have friends. So I want to know, all of you, if you have friends, raise your hand. Okay, if anybody near you didn't raise their hand, gently wake them up, or if they're awake, make sure you make them your friend, because we're all in this together. Now, this has a bunch of names, and the good thing is these all have acronyms, too. So LLS is the Leukemia and Lymphoma Society. They're the third largest cancer organization in the United States, behind Susan B. Komen for breast cancer and behind the American Cancer Society. We have revenue of about $4 million. They have revenue of 100 times greater, actually 110 times greater. Their revenue is $440 million. We have 7 employees. They have 1,177. Now, if any of you are mathematically challenged, that's more. So it's good to have friends like this. Cancer support community and cancer care, they deal with all cancers. They deal with breast cancer. They deal with lung cancer. They deal with prostate cancer, brain cancer, and blood cancers. Cancer support community has over 190 physical locations where you can walk in and get help. We don't. We have 60 support groups worldwide. NCCN is the organization that writes the guidelines that doctors follow to treat each and every cancer disease in the world. It's the world expert that's translated everywhere. These people are working with us. These people, they're working with us. Okay, and they worked hard. We had 6 Zoom calls. We actually had a live in-person meeting back in August last year when it was even scarier to be in person, and they all came. And we had high-level people. We didn't have the 1,776 person at LLS. We had high-level people. We had the CEO from the Lymphoma Coalition in all of our phone calls, all of our meetings. We had the Chief Operating Officer from Cancer Care. You know, why are they paying attention to us? Because they recognize the value of what we're doing and how rare our disease is, and that we can do things, and we have connections with our community that they can't possibly replicate. So it's good to have friends like this working for you. And it's good for you to know that we have friends that are all dedicated to making your lives better. Now, okay, so we get together, all these organizations, and we decide, what are our objectives? What are we going to do? Well, the first objective is to have easy access to accurate, current, and reliable information about WM to improve their overall quality of life. We don't want anybody to be trying to run their life by Dr. Google. It's very dangerous. We want to make sure the best information is available to every single person, every single place. It'd probably be good if I'm on the same page as what I'm talking about. We wanted to reduce duplication effort. All these organizations are off trying to get Dr. Trian to talk to them and Dr. Ansel to talk to them and Dr. Mattis to talk to them. That's a waste of time and effort. We want to do more things together and save our precious resources. We want to provide skills or literacies to enable WMers to best utilize the information that you get. Once we create it, can you use it? And then we want to build awareness again of WM and IWMF among W patients worldwide. Okay, so what are these patient skills needed? Well, first is healthcare literacy. Now, I don't know about you, but I understand every single piece of data that the IWMF produces. Every one of those charts yesterday I could have done myself. Well, maybe half of one. But really, healthcare literacy is not about how many degrees you have. It's not about how many levels, how many colleges you went to or how good they were. It's about whether you can understand written scientific information. And we're blessed with people like Glenn Cantor, who's here, who understands all this stuff at the same kind of level that that Ansel and Treon do, I think. But that's not for all of us. So what we're doing is we're working with Deborah Enton. I think Deborah's here. Deborah, are you here? If you are, stand up. If you're not, don't stand up. Oh, she is here. Well, Deborah is working to make all of our publications more understandable. That's both organizing the thought process for it's easier for us to digest, and the language to making it easier for us to digest. Because we really don't care whether Glenn Cantor can understand it or not. He can. We care about whether I can understand it and you can understand it. Financial literacy. We want to make sure that everybody understands and finds the resources that they need. We want to make sure, this is particularly an issue in the United States. We are blessed in the United States with the best drugs, but they cost the most. Other parts of the world, the drugs may not be the same, but the cost isn't the same. So we want to make sure that you and you and you are choosing the drug that's best for you, not the drug that you can afford. And you'll see some new information coming out about that soon. Then communicating with your medical team. You should be in partnership with your medical team. And so I'll touch on that. And then digital literacy. I don't know about you, but I sometimes struggle with keeping up with them youngins. I try to keep a 13-year-old boy captive in my basement, but the authorities frown on that, so I don't do that anymore. But I'll tell you more about that in a minute. And fortunately, well, let me talk about this one for a second. The healthcare literacy is ongoing, and financial literacy, there's a new support section that's going to be published on the IWMF website soon. And we used to have 1, then 2, then 3, and now we've got 4 different organizations where you can go to get financial assistance. The most recent one we added was Cancer Care, and they will give up to $10,000 a year in support if you qualify. Then we have a global webinar with cancer support community that's scheduled for later this summer. Maury Gertz, who's not here this time, but for you guys who haven't come next time. I'm sure he'll be here. Maury's a treat all by himself. He's worth the price of admission. He rewrote 2 publications. Should I get a second opinion? You should still read the article, but that's the short answer. And getting the most from my provider care. Now, he wrote those in 2013 and 2014, and he updated them. The most significant update was his picture. He looks a little different now. Anyway, they're on our website, and they're in the newly diagnosed patient kit that everybody gets. And then digital literacy. One of our new partners we'll talk about in a minute is PEN, another acronym, yay! And that's Patient Empowerment Network. And they have digital Sherpas. Now, you know that nobody climbs Mount Everest by themselves. They've all got Sherpas. Well, this is the same idea. We get youngins to teach us oldins how to use the WM website better and reach the data that you need. Now, we've got more friends. You all know Steve Treon, Steve Ansel, Dr. Castillo, and Janice Rosick. Now, I'll tell you a little story, okay? So, at the very beginning of the Global Patient Initiative, I asked all those partner organizations to send me everything that they had ever written about WM. And I got everything that we had ever written about WM. That was a lot. And they said, okay, Carl, tell us what's different and what's in conflict. So I'm waiting around my office. I hear my copier crying in the corner. And if you ever run out of blue ink fast, it's because your copier's crying. And my computer's moving about the speed of a 95-year-old who's just run his first half marathon. And I look at this stuff and I go, well, sure, I can do this. I could have it done lickety-scoop maybe 2030. 2032, but sure. So I figured, now that's not really the issue. What's really the issue is, what's not in all the materials. Not what is, what's different, what's not there. Because there's a whole bunch of things that are not there that we know because we're patients. So there are things like, how long am I going to live? Are my kids going to get it? What did I do wrong to get this? What is this rituximab flare thing? So I did a draft, and I recruited friends. I got Dr. Treon and Dr. Ansel to help me write this. So then I came back to the bigger group of our partners, and they said, and I also took it to the board, and the partners said, this is really, really good. But partners are a lot like spouses. They have really good ideas about what else you should do. That's for you. So they said, well, we need one of these for doctors. I said, good idea, but I have no idea how to write one of these for doctors. So I went to these next two people on this slide, and they volunteered to write something that translated this stuff into doctor language, which is a whole nother language. It's actually one we try to translate too. And I took this same document to the board, and the board said, hey, this is great. We should send it to all of our patients. I said, okay, good idea. And then eventually we took this back to Dr. Ansel and Treon and I worked on it some more, and then we took it to our full scientific advisory committee and got all of them, about 30 other doctors, to give us input. And so this is what we ended up with, and this is the reaching patients through doctors. Remember I said we wanted to reach people faster by going through doctors? This brochure is now available. It's written in doctor language, so I don't necessarily recommend you reading it, but if you want to, get it and take it to your doctor. Now don't take it to Dr. Treon and Dr. Ansel and Dr. Sorosik, but do take it to your local community oncologist. We can get that. It's either available to download off our website, but we put it to good use. Here's how we used it. We direct mailed it to 11,034 U.S. community oncologists who worked in blood cancer. Did you know there were that many? And it's important because Ron here, his doctor is actually 11,033. So it's a good thing we got to that guy. And they were endorsed by the 6 organizations. Now, can you imagine this? Here's the IWMF that you've never heard of as a doctor, and they've got this thing they sent in the mail to you. Circular file time? Well, maybe not. Wait a minute. It's endorsed by the LLS. It's endorsed by the IWMF, by Lymphoma Coalition, by LRF, all these other people. Maybe we should open this. And hopefully they did. I guarantee you a lot of them went to circular file, though, because most oncologists, community oncologists, only see 0, 1, 2, or 3 WM patients in their career. So they don't have a lot of headspace for our disease. And also, we then sent a follow-up email to 9,000 of these doctors. And then Dr. Sorosik did a podcast with LLS. Again, you can listen to it if you want to, but it's doctor speak. But this is a way to try to communicate this information. And then we also reached out to a new partner called, in the UK, called Scientific Education Services, which would probably be good if I showed it to you on this slide. And this is, Lymphoma Hub is a global site targeted to doctors. And they have unique visitors from around the world. You can see there are 67,000 visits from the Americas, and 67,000 visitors, 44% from the Americas, 39% for Europe, 13% from Asia, and 3% for the rest of the world. And this content created by our new partner reaches out to them and tells them about things like this new booklet about talking to your doctors. And what's coming now is we have our first big training program. There's continuing medical education, both for doctors and nurses, and that's coming again in this fall, we hope. And it'll be in partnership again with LLS. We can't possibly do this by ourselves, but we can do it with our friends. And we're translating this information into 10 languages, and that'll be available very soon. End of the month, hopefully. So then we go back to our friends, and they say, that is great. You need one for nurses. And I go, well, I know just about as much about writing to nurses as I do about writing to doctors. And fortunately, Dr. Sorosik stepped up to do that, and that will be available shortly. And the nice thing about this is that, let me just go, oops, touchy fingers. So we are trying to reach nurses, and Deborah Anton, who stood up before, is leading that charge. And this is the three biggest organizations, and they're all acronyms, but we're not going to go over them. But the best thing about this is that next weekend, actually next week, ONS, which is the largest organization of nurses, has their national conference in San Antonio. And guess whose materials are going to be there? Ours. Going to be at some of our partner booths. Now, how cool is that? And that's what having friends is about. Now, you might have noticed, let me go back a second. I figured out how to do this. I thought I did. See that color scheme? We have two color schemes now. We do three, but that's too much for us to figure out. Two, this is what all of our professional publications will look like. And then all of our ones for patients will look like this. Can you tell the difference? Yeah, I can on a good day. Anyway, so this is, again, something that I worked with Dr. Ansel and with Dr. Treon, and it's essential information, and it's available here live. If you haven't picked one of these up, you can, and for a small fee, I will autograph it. Donatable. For a large fee, Dr. Treon and Dr. Ansel will autograph it. One of the things we figured out, too, is, look, when you were all diagnosed and when I was diagnosed, I was told I had 3 to 5 years to live in 2006. And as far as I can tell, I'm still living. And all of you are, too. And now it's more like 15 to 20 years. But when we looked at all of our materials were about the disease and about the disease treatment. We didn't have nearly enough information about living well with WM. So we have now worked on a new project, and we have 3 phases: nutritional and physical wellness. And if you look in this month's Torch, you'll see an article that Shirley Gans wrote on nutrition and physical wellness. Emotional issues, and you heard the folks from Beijing talk about that. Let's talk about it. Emotional issues are difficult. It's not all that easy. Being told you had 3 to 5 years to live and your son's not out of college yet, and it's like, no. And designing your headstone doesn't take that long, but it's like, anyway, it's an important thing. And then financial issues, and again, that will be out soon. So those will be on our website soon, and there's going to be an upcoming IWMF Cancer Support Community webinar on financial issues, primarily for the U.S., but elsewhere too, that Newton and his team are putting together. And here's more new partners. I mentioned Patient Empower Network. Those are the ones with the digital Sherpas. Scientific education support. Those are the guys that are helping us reach doctors on the lymphoma website. NORD. NORD is actually, Lori mentioned them. NORD is the National Organization of Rare Disorders, and they have a whole bunch of members, but we've just set up a new program. Newton and Shelley set up this program where we will reimburse people to go get second opinions. Now, that applies not only to people in the U.S., but people internationally. So how cool is that? And then Eurotas is going to be the organization that helps us expand in Europe. This is another build side. Watch this. There's Paul Kitchen, who heads up our international committee, Bob Perry, Suzanne Orn, and Annette Aberdeen. Could you guys stand up? Paul's not here. The rest of you could just stand up. And these are the people that are going to help us, but there's more. Jane Nichols is the WMUK, that's our UK affiliate. She's the CEO there. She's going to be a global consultant helping us figure it out. And then we have Beth Mitchell, our first international employee. Beth, could you stand up? Now, there's a whole lot of you yesterday who were standing up with 20 years experience. Did you ever think the IWMF would have an international employee? No. Nah. So here's what's happening. In Amsterdam in October, we're going to have an affiliate meeting and a partner meeting where we're going to invite all those people who we don't yet know who they are, that are like LLS and LRF and all those people who helped us here. We're working on developing that list of people. And then we're doing a mini Ed Forum. And we already have lined up some exciting speakers like Dr. Dessau, Dr. Voss, and Dr. Minima. And then we'll expand to the rest of the world in 24 and 25. So now I'm going to end, thank God, with a challenge and a promise. Now, I don't know if you can read those little numbers at the bottom, but the challenge is this. I'm asking all you people at home and here that are international to help the IWMF raise more funds to support international patients and caregivers. Support my acronym, GPI. If you look at this, what it shows is that it's total revenue and then what we got from international sources, including our partners, our affiliates who've donated to help support our roadmap. So about 5% of the money comes from international donations, and about 95% comes from the U.S. Said another way, we get maybe 80 to 100 donations yearly internationally. Now, we understand there are different cultures and tax advantages and all that stuff, but if you have the means, please donate to the IWMF or donate to the affiliate in your country if they're set up to accept donations. Ask them to pass it along back to us through the roadmap. That way we'll have more funds, because all this stuff costs money, unfortunately. Even with friends, it still costs money. So that's the challenge. And here's the promise. Although WM is a rare disease, no matter where you are in the world, with the IWMF, you're never alone. You're not alone if you're in Peru. You're not alone if you're in Croatia. You're not alone if you're in Germany. You're not alone if you're in South Africa. You're not alone in Israel. You're not alone in Omaha. No matter where you are never alone with the IWMF, and the GPI is meant to make sure that's true than it's ever been. So thank you.